Welcome back. As we enter January, many people will be focused on increasing fitness routines, eating more healthfully, engaging in more self-care, and nurturing relationships. Those are all important to overall health. However, what most people usually ignore is that one of the most important steps they can take for optimal health, scheduling an annual wellness exam with their doctor ASAP. We're joined this morning by Dr. Jaron Trost of Optum New Mexico to talk more about annual wellness checks and why they're so crucial to preventing and detecting serious disease. Good morning, doctor.
Thank you for having me.
Thank you so much for being here this morning. Why is an annual wellness check so important?
I think that a lot of people start with New Year's resolutions, like eating healthier, exercising. But really, wellness checks are so important because a lot of the diseases that we screen for could be without symptoms, or what we call asymptomatic. Right? So when you go into a wellness screening, we do a lot of screening tests that need to be done every year, every couple years, and sometimes that just falls off, right? If you don't go see the doctor, you kind of forget about it. But high blood pressure, diabetes, a lot of these things can be caught by simple blood tests.
And you just mentioned two of them, but what are some other screenings that may be conducted at one of these exams?
So when you talk about screening tests in medicine, it's based on your age, right? So after 50 years old, we recommend colon cancer screening. Maybe we recommend breast cancer screening after 40 years old. Maybe we recommend lipid screening after 40. So it all depends on your age, but there are many screening tests that you don't necessarily know to ask, but that is important for your doctor to talk to you about.
And you just mentioned it. There are questions that patients should be asking when they go into these exams. What are some of those questions?
The biggest hidden questions that I tell patients are many people are on a lot of medications. So it's always important to ask your doctor if they're interacting with one another, because some symptoms can be caused by medications that you're taking. In addition to medications, ask your doctor or your provider what screening test should be used, right? Have that open dialogue, that two-way communication, because screening tests are different. Sometimes people can have MRIs or CT scans, but it's always important to talk about those specifics with your doctor.
What steps do some of these tests come with, and should patients be concerned about any dangers or side effects from them?
Very good question. You know, a lot of patients may be scared of needles, right? A lot of it are blood tests, but really are very simple screening tests like blood test, chest x-ray, colonoscopy, stuff like that. But it's really a lot of the stuff the patient doesn't have to do themselves. Really let Optum, let other providers do the work, and that's kind of how we should all get it done.
And when going into one of these appointments, doctor, what is something that patients, you mentioned the medication, but other things that patients should mention to their healthcare provider when going in?
Really, what I tell my patients, I really give them the chance to talk. I really try and listen to them. So really I really want the patient to be honest with what symptoms they're experiencing. Many patients put their symptoms under the rug, and that's what happens when diseases get out of control. So there has to be that trust between physician and patient that lets that patient come forward with symptoms. Hey, I've had this back pain. I get this chest pain at night. Maybe I think I'm drinking too much. So really what I say is, like, be honest with your provider, because that's really where good healthcare is achieved.
How long for the results to come in, and where can the patients find them?
So usually with Optum, and I know with other places too, there's a patient portal, and usually with Optum, actually the patients are getting the results even before I see them, right? So it comes right to their phone or their email. And so it usually takes a couple weeks for the screening test to come back, maybe less for blood tests. But usually you could go see the doctor on a Monday and pretty much have everything done in a couple weeks. So it's really not a long-term commitment. And that's why we say it's so important to get to your doctor early in the year, right? To get these screening tests early so that they can all be done early in the year, and you could have a healthy year.
Sure. Where can we go for more information?
Yeah, it's, you know, Facebook, Instagram, Optum New Mexico. We have 9 primary care clinics, but really just the internet. You can look our number online. It's all over the place, but we're happy to help you.
Perfect. Thank you so much for being here this morning with some very good tips. For a full recap of the entire interview, head to alwaysonkRQE.com.